Hello friends, welcome all of you on my YouTube channel here on Nursing File. Today in this video, we are going to learn about the nursing care plan on amputation. This is very important nursing care plan, and through this video, you learn this care plan very easily. And this video helps you to writing the nursing care plan in examination purpose or in the assignment work purpose. तो फ्रेंड्स आइए देखते हैं यहाँ पर amputation का nursing care plan. यहाँ पर नर्सिंग केयर प्लान से पहले हम एक एम्पुटेशन का एक शॉर्ट इंट्रोडक्शन देखते हैं, मीन्स व्हाट इज़ द एम्पुटेशन. तो ये देखते हैं यहाँ पर फर्स्ट एम्पुटेशन मीन्स एम्पुटेशन इज डिफाइंड एज द सर्जिकल रिमूवल और लॉस ऑफ बॉडी पार्ट सच एज आर्म्स लिम्स इन पार्ट और फुल. मीन्स एम्पुटेशन मीन्स हम सर्जरी द्वारा आर्म्स या लिम्स का फुल्ली या पार्शियली रिमूवल करते हैं. दिस इज कॉल्ड एम्पुटेशन. आप यहाँ डायग्राम में देख रहे हो, दिस इज द एम्पुटेशन of the leg. Next, causes of amputation here: severe infection with extensive tissue damage, gangrene, trauma resulting from accident or injury such as crash or blast wound, congenital pediatric limb deficiency undergoing conversion amputation, congenital deformities of digits or limbs, congenital extra digits or limbs, necrosis or necrotizing fasciitis, cellulitis, peripheral arterial disease, frostbite, malignant cancerous tumor in bone or muscle of the limb. Example, osteosarcoma, conditions that affect blood flow, for example diabetes. तो इन कंडीशंस में हम एम्पुटेशन करते हैं. नेक्स्ट, nursing care planning for patient who had an amputation includes support, psychological and physiological adjustment, alleviate pain, prevent complications, promote mobility and functional abilities. Following are the nursing diagnosis and nursing care plans for the amputated patient. फर्स्ट देखते हैं यहाँ पर नर्सिंग केयर प्लान फॉर द एम्पुटेशन. यहाँ पर हम डिफरेंट नर्सिंग प्रोसेस स्टेप यूज़ करेंगे. नर्सिंग असेसमेंट, डायग्नोसिस, गोल या डिजायर्ड आउटकम, नर्सिंग इंटरवेंशन, रेशनल एंड एवोल्यूशन. नर्सिंग असेसमेंट में देखते हैं फर्स्ट सब्जेक्टिव डाटा. Here patient report expression of the pain and discomfort with movement, refusal to move. Next objective data देखते हैं आप. Nurse assess or observe about the limited range of motion, uncoordinated movement, poor balance, inability to turn, impaired transfer or ambulate, decreased muscle strength. On the basis of these assessment data, we write here the nursing diagnosis, that is impaired physical mobility related to loss of limb. पर गोल होगा टू मेंटेन फंक्शनल पोजीशन. नर्सिंग इंटरवेंशन रेशनल देखते हैं यहाँ पर. फर्स्ट इंटरवेंशन, इंक्रीज पेशेंट टू परफॉर्म प्रिस्क्राइब एक्सरसाइज. रेशनल होगा टू प्रिवेंट स्टम्प ट्रॉमा. स्टम्प मीन्स द रिमेनिंग पार्ट आफ्टर एम्पुटेशन. नंबर सेकंड, प्रोवाइड stump care on a routine basis, inspect the area, cleanse the and dry thoroughly and rewrap stump with an elastic bandage. Reason होगा to promote early healing and prevent complications. Number third, measure circumferences periodically. Reason होगा measurement is done to estimate shrinkage to ensure proper fit of sock and prosthesis. Number fourth intervention, rewrap stump immediately within elastic bandage. Elevate if immediate or early cast is accidentally dislodged. Prepare for reapplication of the cast. Reason होगा edema will occur rapidly and rehabilitation can be delayed. Number fifth intervention होगा assist with specified ROM exercise, range of motion exercises. Reason होगा prevent contractures, deformities. Number six intervention होगा maintain knee extension. Reason होगा to prevent hamstring muscle contractures. Number seven intervention, provide trochanter rolls as indicated. Reason होगा prevents external rotation of lower limb stump. Number eight intervention, demonstrate and assist with transfer technique and use of mobility aid like trapeze, crutches or walker, रेशनल होगा फैसिलिटेट सेल्फ केयर एंड पेशेंट इंडिपेंडेंस. नंबर 9 इंटरवेंशन देखते हैं असिस्ट विद एम्बुलेशन, रेशनल होगा रिड्यूसेस द पोटेंशियल फॉर इंजरी. नंबर 10 इंटरवेंशन इंस्ट्रक्ट पेशेंट इन स्टम कंडीशनिंग एक्सरसाइज, रेशनल होगा हार्नेस द स्टम बाई toughening the skin and altering feedback of resected nerve to facilitate the use of prosthesis. Number 11 intervention होगा provide foam or flotation mattress is additional होगा reduces pressure on skin and tissue that can impair circulation. Number 12 intervention refer to the rehabilitation team additional होगा to meet individual need and strength. After providing these interventions we write here the evaluation of first number care plan here. तो यहाँ एवोल्यूशन होगा फर्स्ट केयर प्लान का. फंक्शनल पोजीशन मेंटेन्ड, जो हमारा गोल था टू मेंटेन फंक्शनल पोजीशन, वो मेंटेन हो गए थ्रू दीज इंटरवेंशंस. नेक्स्ट देखते हैं केयर प्लान नंबर सेकंड. नर्सिंग केयर प्लान नंबर सेकंड में सेम स्टेप्स हम यूज कर रहे हैं. यहाँ पर नर्सिंग असेसमेंट, डायग्नोसिस, गोल, नर्सिंग इंटरवेंशन, रीजनल एवेल्यूशन. नर्सिंग असेसमेंट में सब्जेक्टिव डाटा में हम नॉट एप्लीकेबल लिखेंगे क्योंकि हमारे रिस्क डायग्नोसिस है. मीन्स there is no sign symptom present and chances of the possibilities of this infection process here. Next objective data देखते हैं. Assess the vital sign, monitor the complete blood count. Next observe the amputated site for the infection process here. Nursing diagnosis होगा risk for infection related to broken skin and traumatized tissue. गोल होगा to prevent risk for infection. Nursing intervention रेशनल देखते हैं. फर्स्ट इंटरवेंशन provide wound care with aseptic techniques, रेशनल होगा to prevent skin infection. Number second flush the wound with sterile saline solution, apply sterile pressure dressing, रेशनल होगा to prevent infection. Number third intervention देखते हैं. maintain sterile technique when changing dressing and caring for the wound, ये रेशनल होगा minimizes opportunity for the infection. Number fourth intervention होगा inspect dressing and wound, note characteristics of drainage, रेशनल होगा early detection of developing infection, provide an opportunity for timely interventions and prevention of more serious complications. Number fifth interventions maintain patency and routinely empty drainage device, रेशनल होगा promoting wound healing and reducing the risk of infection. Number 6 intervention cover the dressing plastic when using the bed par or if incontinent, रेशनल होगा prevent contamination in lower limb amputation. Number 7 intervention होगा expose system to air, wash with mild soap or water after dressing are discontinued. यहाँ पर रेशनल होगा maintain cleanliness, minimize skin contaminants and promote healing of tender and fragile skin. Number 8 intervention monitor vital signs, रेशनल होगा temperature elevation and tachycardia may reflect developing sepsis. Number 9 intervention obtain wound and drainage culture and sensitivities as appropriate, रेशनल होगा identifies the presence of infection and specific organisms and appropriate therapy. Number 10 intervention होगा administer antibiotic as indicated, रेशनल होगा to treat infection process. After providing these interventions we write here the number second care plan evaluation here. This is evaluation. Now risk for infection prevented, जो हमारा गोल था to prevent risk for infection हमने अचीव किया थ्रू दीज इंटरवेंशंस. नेक्स्ट देखते हैं केयर प्लान नंबर थर्ड. Here this is the care plan number third. Nursing assessment, nursing diagnosis, goal, intervention, rational evaluation. First nursing assessment में subjective data, patient verbalize about pain, objective data, guarding and protective behavior. And nursing diagnosis here acute pain may be related to physical injury, goal होगा to relieve pain. Nursing interventions rational देखते हैं. Intervention number first assess the pain, its location, intensity, on pain scale 0 to 10 scale irrational होगा, provide baseline data for interventions. नंबर सेकंड देखते हैं, elevate affected part by raising foot of bed slightly are used below. Irrational होगा, this activity lessen edema formation by announcing venous return. नंबर थर्ड इंटरवेंशन देखते हैं, provide general comfort measures, example frequent turning, back rub and diversional activity. Irrational होगा, to promote relaxation and may enhance coping abilities and may decrease occurrence of phantom limb pain. Number fourth intervention, encourage use of stress management techniques, example day breathing exercise, visualization and guided imaginary. Irrational होगा, promote relaxation and may announce coping abilities. Number fifth interventions, discuss or monitor use of transcutaneous electrical nerve stimulations TENS of the system. Irrational होगा, TENS useful in treating retractable phantom limb pain. Number six intervention, administer prescribed analgesics here. Irrational होगा, to treat pain. After providing these interventions, we write here the evaluation steps. Here evaluation step देखते हैं यहाँ पर. Now pain is relieved. Goal था to relieve pain, वो हमने अचीव किया through these interventions. Next देखते हैं care plan number fourth. This is the care plan number fourth here, using same nursing process system, nursing assessment, diagnosis, goal intervention, rational evaluation. First nursing assessment में subjective data are not applicable because this is the risk diagnosis, and objective data here assess the vital sign, assess the lab values, assess the peripheral pulses. Next nursing diagnosis होगा fourth care plan का, risk for infective tissue perfusion may be related to reduce arterial venous blood flow, tissue edema, hematoma formation and hypovolemia. Goal होगा to reduce risk for ineffective tissue perfusion. Nursing interventions रेशनल देखते हैं. First, monitor vital sign, palpate peripheral pulses, noting strength and equality. रेशनल होगा, provide baseline information to the interventions. Number second interventions, perform neurovascular assessment, sensation, movement, pulse, skin color and temperature. रेशनल को post operative tissue edema, hematoma formation or restrictive dressing may impair circulation to stump, resulting in tissue necrosis. Number third intervention, inspect dressing and drainage devices, noting amount and characteristics of drainage. Irrational होगा, continued blood loss may indicate the need for additional fluid replacement. Number fourth interventions, if bleeding occur, apply direct pressure to the bleeding site and contact the physician immediately. Irrational होगा, to control bleeding. Number fifth intervention देखते हैं, if the patient experiences throbbing after the stump is wrapped and bandage may be too tight, remove the bandage and reapply. Irrational होगा, throbbing indicates impaired circulation. Number six intervention, check the bandage regularly. Irrational होगा, to prevent further complications. Number seven intervention, investigate reports or persistent or unusual pain in the operative site. Irrational होगा, hematoma can form in muscle pocket under the flap, compromising circulation and intensify pain. Number 8 intervention होगा, monitor laboratory studies, hemoglobin and hematocrit. Irrational होगा, indicates hypovolemia and dehydration that can impair tissue perfusion. Number 9 intervention, monitor prothrombin and activated partial thromboplastin time APTT. Rational होगा, evaluate need and effectiveness of anticoagulants therapy. Number 10 intervention होगा, encourage and assist with early ambulation. Rational होगा, enhance circulation, help prevent stasis and associated complications. Number 11 intervention, administer IV fluids and blood products as indicated. Rational होगा, maintain circulating volume to maximize tissue perfusion. Number 12 intervention, apply embolic and sequential compression hose to the non-operated leg as indicated. Rational होगा, enhance venous return, reducing venous pooling and risk of thrombophlebitis. Number 13 intervention. Administer low dose anticoagulants as indicated. Resloga may be useful in the preventing thrombus formation without increasing the risk of post-operative bleeding and hematoma formation. After providing these interventions, we reiterate the evaluation steps of this care plan. Now here evaluation यहाँ होगा. Reduce risk for ineffective tissue perfusion, means जो हमारा गोल था to reduce risk for ineffective tissue perfusion हमने उसको अचीव किया through these interventions. Next देखते हैं care plan number 5. Here this is the 5th number care plan. यहाँ भी हम सेम नर्सिंग प्रोसेस स्टेप यूज़ करने वाले. नर्सिंग असेसमेंट, डायग्नोसिस, गोल, इंटरवेंशन, रेजनल एंड एवेल्यूशन. नर्सिंग असेसमेंट में सब्जेक्टिव डाटा. Patient verbalizes negative feeling about amputee, means amputated part, and report of fear of rejection by others. And objective data: assess degree of support available to patient, determine specific cause for low self-esteem, assess content of negative beliefs. Next, nursing diagnosis होगा. Situational low self-esteem may be related to loss of body part, change in functional abilities. गोल होगा to promote low self-esteem. Nursing intervention sensitization होगा. Encourage expression of fear, negative feelings and grief over the loss of body part. Reason होगा to help the patient begin to deal with the fact and reality of life without a limb. Number second, interventions provide pre-operative information including types and location of amputation, type of prosthetic fitting, if appropriate, immediate delayed, expected post-operative course including pain control and rehabilitation. Reason होगा to facilitate post-operative recovery. Number third, intervention ascertain individual strength and identify previous positive coping behavior. Reason होगा helpful to build on strength that are already available for the patient to use in coping with the current situation. Our fourth intervention होगा encourage participation in activity of daily living, ADLS. Reason होगा promote independence and enhance feeling of self-worth. Number fifth, interventions provide opportunities to view and care for the stump using the movement to point out positive sign of feeling. Reason over to help the patient with this acceptance. Number six, intervention को encourage and provide for a visit by another amputee, especially on who is successfully rehabilitating. Reason होगा a peer who have been through a similar experiences serve as a role model and can provide validity to comment and hope for recovery and normal future. After providing these interventions, we write here the evaluation steps of this care plan. Now here evaluation होगा. Now patient adapt and accept amputation. गोल था हमारा टू प्रमोट लो सेल्फ एस्टीम, वो यहाँ पर हमने अचीव किया है. मीन्स आफ्टर प्रोवाइडिंग दीज इंटरवेंशन नाउ पेशेंट एक्सेप्ट द कंडीशंस एंड अडेप्ट विद द सिचुएशन. तो फ्रेंड्स ये तुम्हारा 5th नंबर केयर प्लान फॉर द एम्पुटेशन. तो फ्रेंड्स हमारा यहाँ पर केयर प्लान फिनिश होता है. आपको वीडियो कैसा लगा इसके लिए अपने लाइक्स कमेंट जरूर भेजिएगा एंड शेयर दिस video with your friends and subscribe my YouTube channel here on nursing file and press bell icon also. Thank you.